Hi, this is Dr. Clive Gallagher. I'm going to talk you through what the usual sequence of events is when you have male to female bottom surgery or vaginoplasty with us here in Indianapolis. So, first things first, the day before surgery, you usually have to take off work, and that is because you're doing what's called the bowel prep. So, for those of you who haven't had the pleasure of an experience of a bowel prep for a colonoscopy, or something like that. Basically, what it means is we give you medication that cleans out your colon. And that's a nice way of saying we give you medication that makes you have diarrhea. And you have so much diarrhea, in most cases you run clear. Now, why would we do something so cruel and unusual? Well, this is because we're working in an area and we're creating a new vagina right down beside where the rectum is. So we want to clean that out as best as possible, just in case there were anything that needed to be done, any sort of surgery that needed to be done to the rectum itself. It's clean and ready for that to be done, number one. And number two, you're going to have a little bit of respite. You're going to have a little bit of time after your surgery where hopefully you're not going to have to go number two or poop, and therefore you're going to be able to recover a little bit more comfortably from your bottom surgery. So you're doing this from about halfway through the day before your bottom surgery, and then you're coming in to see us the morning of surgery. Usually it's an early start, usually 2 hours before your surgery. You come in, we put you in a hospital gown, we put an IV in, and we have you meet your anesthesiologist. And so your anesthesiologist and their team will answer any questions you have about what medications they will give you, and then you go off to sleep for the surgery itself. And most patients will tell me that their experience with that is it's like they blink and their surgery's done. It's a different case for the patient's family who's waiting around. Usually bottom surgery takes us about 4 or 5 hours depending on the patient, but it oftentimes feels like a lot longer for the family between waiting for the patient to go off to sleep, the surgery to be done, and the patient to wake up. So it's a long day usually for the family if they choose to wait around. So once you wake up from your surgery, you go to what's called the PACU. So that's the recovery unit. And usually at this point, because you've been under for so long, you're still very sleepy. I always go talk to my patients there, and they very rarely remember that we've talked at all. So one thing we do before you wake up in bottom surgery is we use a lot of numbing medication. There's a new medication we use, which is like a very long-acting Novocaine, like something the dentist would use. So my goal for every patient when she wakes up, she should be relatively pain-free, if at all possible. In most patients, though, we do have to give some opiate medications in order to make sure they're comfortable. And depending on the patient's pain level, we may supply you with a little button that you can press as well for pain. So usually the day of surgery, most patients don't remember too much. They're a little bit out of it. We keep you in bed. Most patients can get something to drink, not necessarily to eat, and they don't really recollect much until the next day we begin to get you back to normal. But that's just a quick synopsis from the surgeon's point of view of what bottom surgery is like to experience. Of course, my patients can tell you much more vivid accounts of this than I can, but this is usually the sequence of events for bottom surgery, male to female vaginoplasty.